My name is Gregory, Gregory, Tiongson, Tiong as in golf, Son. I am a pediatric hospitalist and I'm the medical director for Bronson Children's Hospital.
Okay, so earlier today we received a press release just basically talking about the position Bronson Hospital is taking on childhood vaccines. Can you talk about that a little bit and why you felt it was necessary to put that out there?
Yeah, as you may know, recently the CDC updated their guidance around childhood immunizations. They changed several of what have been typically routinely recommended childhood immunizations to three different categories. One, universal for all, two, those for high-risk groups, and three, in the context of shared decision making, which is significantly different from what the pre-existing immunization schedule is. My estimate of this process has been that it is somewhat undisciplined and misinformed. At least this approach is. There's really no illumination of additional data that led to this decision making. And in fact, I would offer that the normal process for immunization practice recommendations, which has typically come through the Centers for Disease Control, is through a process which the Advisory Council for Immunization Practices, or ACIP, typically is a group of scientific experts, content and otherwise, who review immunization practices and then offer recommendations to the CDC for subsequent changes or updates to the guidelines. As earlier this actually earlier last year, the Secretary of DHHS essentially reconfigured the ACIP with a whole new group of local experts. And that group's been meeting through the year and had a number of opportunities to review immunization practices, and including just recently in the fall and in the winter, of which some of the changes that have been proposed, some of the changes that are recommended by the CDC actually were not endorsed by the ACIP for what it's worth. And in fact, the ACIP had no bearing in the decision making through the CDC. They didn't refer to any specific vote or debate specifically related to these changes. And so what I see is, as I said, undisciplined and somewhat uninformed decision making from folks at the CDC based on what seems to be an uninformed and an ignorant approach to public health that's not based on science, not based on the evidence, and certainly not based on decades and decades of clinical experience and experimental evidence of the effectiveness and the safety of the childhood immunization schedule as it currently exists.
Now, I was listening to NPR, I think just yesterday, where they were saying that we are very close to, in terms of measles, not being able to say that the United States is any longer has eliminated measles. Can you talk about that a little bit and as use that as an example?
Yeah, measles is an excellent example for illuminating how immunization practices can have a huge and significant impact on a disease. In the late 1980s and early 90s, there was a significant outbreak of measles in the United States, leading to thousands and thousands of cases. At that time, immunization practices through the ACIP, I think, through at least through the CDC, recommended an additional or second dose of the measles, mumps, and rubella vaccination. After that time, the number of U.S. measles cases reduced significantly. Roughly by the year 1993, there were very few cases and very few hospitalizations. In 2025, we had over 2,000 measles cases, which is the most we've ever had actually since 1992. 1991 was quite a bit more, but 1992, there was just a few less than we did this year. So we have to look back more than 30 years to find the same number of measles cases. And we had 240 hospitalizations just this year from measles, which is more than we've had since the 90s, including three deaths. The last time we had any more than three deaths from measles was in 1992. So since 1992, with the adoption of more aggressive immunization practices and universal recommendations, particularly for MMR, we essentially eliminated measles from the microbiological and community health perspective for the United States. And over the last several years, we have seen that change. And in particular, we are seeing adoption rates for immunization by families to be declining significantly over the last several years, which has led to some increased outbreaks. Back in 2019, when we had 1,200 cases of measles, and then we had a decline for several years. But then again, last year, just over 2,000, which, as I said, was more than we've had since 1992.
And it seems there's no way getting around it. It's all correlated with the pandemic, right? All the misinformation that came out at that time. Is that accurate to say?
Yeah, I think we have seen in the community health atmosphere a lot of misinformation and misguidance, particularly from folks that are uh, influencers in the political sphere and the social media sphere that don't have a basis of scientific education, scientific study to back up those claims. And as I said, the overwhelming clinical experience, rigorous scientific evidence suggests that the immunizations that are currently recommended by the AAP and others are safe and very effective to eliminate or reduce the transmission of serious preventable infectious disease. And so we are seeing a pretty steady decline in folks um, adopting what is really excellent and evidence-based recommendations regarding immunizations without really any new data and a lot of language, in particular from folks in the political and social media sphere around things that are really have no scientific foundational basis, even from those that would be considered the appointed experts in our federal USD HHS system.
When you have a patient that comes to you and says that they are really concerned about the vaccines and they don't want to have them, how do you handle that?
I think we try to meet folks where they're at and understand what their concerns are. Our best response is to say, tell me why, or tell me what your concerns are, and to be someone who can offer then additional information or offer them some education around what is scientifically known about vaccinations and immunizations. But really, it starts with asking why and asking questions. And some folks understand something new, and we have that conversation, and some folks don't. Unfortunately, as I said, the social fabric around immunizations has been unfortunately rather tattered in terms of how folks perceive the information that they receive and how they trust that. I know that DHHS, the US DHHS, really wants to talk about transparency, wants to talk about restoring trust in scientific evidence. And unfortunately, what I have seen as a person who is very interested in advocacy for children's health and the health and well-being for children in our community, what I see is doesn't feel transparent, doesn't feel scientific, doesn't instill trust or a sense of security to me, particularly as I mentioned, when the ACIP, which is the organizational body that has been appointed to give specific advice as a group of scientific advisors to the CDC to make decisions like this about changing immunization schedules weren't even involved or weren't even consulted formally about these changes. And that is capricious, irresponsible, in my opinion, and does not create trust in the scientific environment, does not create transparency, and if anything, might lead to more concerns about what you know how society is looking out for the best health of our communities. Yeah, I mean, I've seen patients who are hospitalized with infections that are preventable. pertussis, the whooping cough infection, Haemophilus influenza, which can cause severe infections, including meningitis and sepsis. I have seen that in several cases, in particular in the last 6 months, cases of those types of infections that have led to hospitalizations, in some cases to severe infections. Fortunately, of late, with the care that we can provide, um, we have had good outcomes for all of those patients, but really, in many ways, those are somewhat preventable diseases if adoption for routine childhood immunizations for those diseases was more broadly adopted. That notion, while is something that we would all wonder and worry about, is not scientifically proven when we observe these children who receive immunizations, and we do not see um, adverse events related to the number of immunizations that they get at any one time. Um, and suggestions around, from folks in our political sphere around it's just too much, quote unquote. That's just really not scientific, and it's not been proven by the literal millions and millions and millions of doses of immunizations that have been given in our country, in the US, over the last several decades. That has not been scientifically proven that any of those concerns are actually scientifically founded. I understand the concern. No one likes to poke babies. We don't like to either, but it's really because we understand how it is very beneficial to their long-term health and well-being.
there anything else you think is important to get out there?
Yeah, I think there's something very interesting that's out there. In August of 2024, the CDC and the US Department of Health and Human Services made a report in August of 24 about the benefits of universal immunization practices. And they studied children from 1994 to 2023, so a very long period of time where there was about 117 million children born during that time. In this study, again, by the CDC and the DHHS, who are now making a different set of recommendations, showed that in that period of time, they were estimating that there were a reduction of, because of universal immunization practices, there were 500 million less infections, 32 million less hospitalizations, and 1.1 million less deaths because of universal immunization practices. So the clinical benefits of what is essentially universal immunization practices for what they were studying at the time. There were a couple that were not included, like COVID and RSV immunization, which is new and incredibly effective. They showed the clinical benefits to be substantial. They also looked at the cost. So, in our society, it's important to understand the fiscal implications of what happens in healthcare. We are not immune to need to be aware of that. And they showed that from a direct cost, meaning the cost to take care of, the cost to deliver these immunizations, and the cost to take care of these children, for every $1 spent with universal immunizations, we saved almost $3.50 was saved. If we look at the society cost, meaning how much it costs for our society to deliver immunizations to these children on a universal basis, to reductions in the impact to society and productivity and all the things, total society cost, for every $1 spent, $11 is saved. So, from a clinical understanding, universal immunization practices, as currently recommended by the AAP and other folks, there's an obvious clinical benefit to the US. We're not talking about, Denmark. We're not talking about other countries. We're talking about in the US. The clinical benefits are obvious, and the financial benefits are humongous for doing this kind of practice. And so, in conjunction with decades and decades of experience with these immunizations and their safety profiles that we understand, why are we making a change? It is not founded in even its own organizational data. It's like I said, it feels irresponsible, it feels undisciplined, and uninformed.